Pregnancy, a great experience every woman feels in her life. The liveliness you feel can be never explained by words, but it is only felt by the mother by herself. There are few discomforts during pregnancy which may trouble these wonderful mothers, in which nausea and vomiting plays a major role. In today's video, let us discuss why this vomiting occurs and how to overcome this issue. Every system of our body may be affected during the pregnancy period. Minor disorders may occur due to hormonal changes during pregnancy, accommodation changes, that is, the baby's adjusting capacity changes the accommodation of the other organs which may alter the functions, then the metabolic changes and the postural changes of the mother. These disorders should be treated adequately as they may escalate and become life threatening in case if it is not treated in the early period. Many women experience some minor disorders during pregnancy and that has to be rectified symptomatically. When we come to pregnancy, this particular hormone, HCG, human chorionic gonadotropin, plays a major role. It is very essential during the first few weeks for the development of the fetus. Higher levels of HCG occur during the first 10 weeks until placenta takes over the function. Here, 50% of the women experience both nausea and vomiting, whereas 25% experience only nausea, that is, the feeling of vomiting, but they don't vomit exactly, and 25% are usually unaffected. This is very particularly present with primigravida mothers, that is, a woman who is pregnant for the first time. Usually, this particular nausea or the vomiting experience happens in the early morning, that is, as soon as you get out of the bed. Once the day begins with vomiting, the full day continues with vomiting. It is usually due to the long hours of fasting in the night, that is around 10 to 12 hours you don't eat anything. So the acid secretions increases the feel of vomiting. So it is always better you eat in between in the night if you feel hungry. So now we'll see how to manage this minor issue. The first step is reassurance. The elders in the family or the friends or the health worker must try to explain the pregnant mother that it is only a temporary complaint for the first 3 months and she will improve after that. That is after when the placenta is taking over the function of the HCG. Explain the mother that vomiting is a positive indicator that she is having adequate hormones in her body which is providing all nutrients for the development of the baby and thereby make her happy for the feel of vomiting. Try to provide a diet that best suits the mother, usually a bland diet. There are mothers who cross their first trimesters only with bananas, idli, milk and curd without any taste. Provide the food that is liked by the mother and not needed for the mother, as that is the demand for her baby. Make the mother understand this and never force anything she doesn't like with strong flavors and odors. Some pregnant mothers may be comfortable with orange and peppermint candies, which may control their feel of nausea and vomiting. Try to provide small frequent diet, that is, instead of providing 3 meals per day, make it as 6 meals per day so that she may not experience long fasting hours that may control vomiting. As there is vomiting, many mothers think that food intake is causing vomiting, so better to avoid intake. But it is totally wrong. Always remember that your baby survives because of you. If no intake for the mother, no energy for the baby too. If you are unable to take solid foods, try to balance it with more fluids and juices. Take fluids in sips so that you may not vomit immediately. See to that you are hydrated adequately throughout the day. As I have said earlier that hormones play a major role for vomiting, try to avoid these type of stimulants. Some pregnant mothers may feel vomiting for strong smells as soap, perfumes and hand washes. There are many pregnant women experiencing the feel of vomiting for the smell of cooking, particularly the smell for rice. So try to avoid these irritants so that naturally vomiting will be under control. As discussed earlier, early morning vomiting causes vomiting throughout the day. So here comes the tips to avoid early morning vomiting. As soon as you get up from the bed, try to eat dry biscuits, crackers before getting out of the bed, which may neutralize the acid secretion and thereby preventing the first episode of vomiting, thereby preventing the other episodes also. Ginger is a very good antiemetic substance as well as a good appetizer. Encourage the mother to drink ginger tea, and some mother may feel comfortable with ginger and honey. Gooseberries, they prevent vomiting. They are good source of vitamin C and found to increase the fair complexion of the baby. Cumin seeds, fennel seeds, cardamom and cloves are found effective in treatment of vomiting. 1 tablespoon of any of these spices can be boiled in water and can be taken whenever you feel the sense of vomiting. Mint leaves can be used as juices to prevent vomiting, or the smell of the mint leaves by itself prevents vomiting. Try to avoid caffeine and fried items as they may induce acidity and can induce vomiting. Caffeine products are better to be avoided as they can cause vasoconstriction and causes decreased perfusion to the fetus. Whenever you feel vomiting, try to follow any of these methods which can definitely help you prevent vomiting. Consult your physician in case if the vomiting is persisting and you feel that you are dehydrating and there is restricted intake of fluids and food. Hope this information was useful. Thanks for watching and subscribe for more videos.